Welcome to NGN NCLEX case study for anorexia with dehydration. A complete case study with questions. Case study. A 16-year-old female with an eating disorder is seen in the emergency department for fainting episodes. Objectives. 1. Apply knowledge of pathophysiology when measuring vital signs. 2. Compare laboratory values to normal. 3. Manage care of a client with a fluid and electrolyte imbalance. 4. Provide care and education for acute and chronic psychosocial health issues. Module 1 Question 1 of 6. The nurse's notes read, 11 a.m. 16-year-old female brought to the emergency department by a car by parents. Client reports syncopal episodes upon standing and appears drowsy. Has a history of anorexia and reports constipation, decreased urine output, amenorrhea, and weakness. Assessment findings include poor skin turgor and lanugo. Oriented to person, place, time, and situation. Weight 38 kg, BMI 14.84 T 96.8 Fahrenheit, pulse 56, respiratory rate 15, blood pressure 88/58. Pulse oximeter 95% on room air. Echocardiogram shows no abnormality. ECG, sinus bradycardia. Labs drawn. Question 1. Which 3 findings require immediate follow-up? Question 1 answer is decreased urine output, poor skin turgor and blood pressure of 88/58. The rationale is decreased urine output and poor skin turgor are signs of dehydration and require immediate follow-up. The blood pressure listed is hypotensive and most likely requires intervention. Amenorrhea, lanugo, and constipation are signs of prolonged malnutrition and not life-threatening complications. Module 2. Question 2 of 6. The nurse reviews the client's history of anorexia and potential causes of the most presenting issues. For each finding indicate if the finding is consistent with dehydration, hypoglycemia, or anemia. Each finding may support more than one type of condition. The findings are poor skin turgor, hypotension, syncope, and decreased urine. Module 2 Question 2 Answer. The findings consistent with dehydration are poor skin turgor, hypotension, syncope, and decreased urine. The findings consistent with hypoglycemia are hypotension and syncope. The findings consistent with anemia are hypotension, syncope, and decreased urine. Rationale: dehydration typically results in poor skin turgor, hypotension, decreased urine output, and can result in syncope. Hypoglycemia can cause hypotension and syncope. Anemia can cause hypotension and decreased urine output. Note that anemia is also seen in clients with renal disease. Module 3 Question 3 of 6. The nurse's notes reads, 1100, 16-year-old female brought to the emergency department by a car by parents. Client reports syncopal episodes upon standing and appears drowsy. Has a history of anorexia and reports constipation, decreased urine output, amenorrhea, and weakness. Assessment findings include poor skin turgor and lanugo. Oriented to person, place, time, and situation. Weight 38 kg, BMI 14.84 kg per square meter, temperature 96.8 Fahrenheit, pulse 56, respiratory rate 15, blood pressure 88/58. Pulse oximeter 95% on room air. Echocardiogram shows no abnormality. ECG, sinus bradycardia. Labs drawn. The lab's results return and the nurse obtains orthostatic vital signs as follows. The nurse documents the results. Complete the following sentence by choosing from the list of options to the right. You may pause the video here. Question 3. The client is most likely experiencing anemia, hypovolemia, or hypoglycemia, as evidenced by the blood glucose electrolytes or hemoglobin and hematocrit, and the blood pressure, heart rate, temperature. Module 3 Question 3. Answer. The client is most likely experiencing hypovolemia as evidenced by the electrolytes and the blood pressure. Rationale. The changes in the blood pressure indicate orthostatic hypotension and hypovolemia. The client glucose is within defined parameters. While the hemoglobin and hematocrit are slightly low, they are not low enough. Module 4 Question 4 of 6. The nurse begins to plan the client's care. For each potential order, specify whether the order is appropriate or not appropriate to include in the plan of care. The potential orders are as follows. Make client NPO. Daily weights at 0-600. Give 1000 ml 0.9% normal saline 4 at 125 ml per HR times 8 hours. Contact isolation. Begin tube feeding now. strict I&O. Give 20 milliequivalents potassium chloride PO daily at 0800. Psychiatric consult. Liquid nutritional supplement. Question 4 Answer. The nurse begins to plan the client's care for each potential order that is appropriate to include in the plan of care. The appropriate orders to include are: make client NPO, daily weights at 0600, strict I&O, give 20 milliequivalent potassium chloride PO daily at 0800, psychiatric consult, and liquid nutritional supplement. Rationale: the client needs to begin gradual refeeding and would not be NPO. The client has no evidence of dysphagia and would not need tube feedings. The client has a low K+ and would benefit from potassium supplementation. The client is hypovolemic and needs fluid replacement. Anorexic clients need strict I&O to ensure adequate intake and that no purging is occurring. The anorexic client will also need a daily weight and psychiatric consult. The client's fear of gaining weight is a sign of unmanaged anorexia. The client shows no signs of infection and would not need contact isolation. Liquid nutritional supplements can assist with caloric intake and prevention of refeeding syndrome. Module 5 Question 5. The nurse note reads: 1100, 16-year-old female brought to the emergency department by a car by parents. Client reports syncopal episodes upon standing and appears drowsy. Has a history of an eating disorder and reports constipation, decreased urine output, amenorrhea, and weakness. Assessment findings include poor skin turgor and lanugo. Oriented to person, place, time, and situation. Weight 38 kg. BMI 14.84 kg per square meter. Temperature 96.8 Fahrenheit, pulse 56, respiratory rate 15, blood pressure 88/58. Pulse oximeter 95% on room air. Echocardiogram shows no abnormality. ECG. Sinus bradycardia. Labs drawn. 11:45. Provider diagnosed client with hypovolemia and orthostatic hypotension and ordered the client be admitted to the medical surgical unit. Client is tearful and withdrawn, stating, "I am going to gain so much weight here. I worked so hard to be thin." 1300, transferred to medical surgical unit for medical management. For fluids started. The nurse receives orders. Orthostatic versus daily and routine vital signs every 4 hours. Strict I&O. Daily weights at 6 o'clock a.m. Give 1000 milliliters 0.9% normal saline 4 at 125 milliliters per hour x 8 hours. Give 20 milliequivalent potassium chloride P.O daily at 0800, first dose now. Question 5. Which tasks can the nurse delegate to the UAP? Select all that apply. Obtain and record daily weights. Take and document routine vital signs. Take and document orthostatic vital signs. Give client potassium 20 milliequivalent PO. Record and document intake and output. Educate client on medical complications of anorexia. Question 5 Answer. Which tasks can the nurse delegate to the UAP? The nurse can delegate the task of obtaining and recording daily weights, taking and documenting routine vital signs, taking and documenting orthostatic vital signs, and recording and documenting intake and output. Rationale: the UAP cannot administer medications, draw routine labs, or educate the client on medical complications of anorexia. Module 6 Question 6. The nurse's note reads at 17:15. Client has improved with 4 fluids. Vital signs are stable. Voided 300 milliliters urine. Psychiatrist with client for assessment. Client to be admitted to a partial hospitalization program in the morning. The nurse has implemented the treatment plan and provided education on the medical complications and the psychosocial components of anorexia. Question 6. For each finding, choose to specify if the statement indicates an understanding or no understanding of the education provided. The statements are as follows. I need to develop non-food related coping skills like journaling to manage my emotions. I am cured, and once I am discharged, I will not need to continue with any professional support. I grew extra hair on my body because my body did not have enough fat to keep me warm. My fainting spells were caused by my body not having enough fluid. My family and I should talk extensively about what and when I am eating to keep me on track. Question 6. Answer. The nurse indicates that the following statements. I need to develop non-food related coping skills like journaling to manage my emotions indicates an understanding of the education provided. I am cured, and once I am discharged, I will not need to continue with any professional support. Indicates no understanding of the education provided. I grew extra hair on my body because my body did not have enough fat to keep me warm indicates an understanding of the education provided. My fainting spells were caused by my body not having enough fluid indicates an understanding of the education provided. My family and I should talk extensively about what and when I am eating to keep me on track indicates NO. Rationale: the client needs to develop non-food coping skills. The client should be discharged into a partial hospitalization program for further support as anorexia does not resolve quickly. The severe body image distortion and maladaptive coping skills need to be addressed further after discharge. The lanugo developed from insufficient fat on the client's body. The hypovolemia was caused by dehydration. The client and family should avoid talking only about food as this can support the client's fixation with weight. Bowtie question. The bowtie response assesses all 6 cognitive skills during the NCLEX. Recognizing cues, analyzing cues, prioritizing hypotheses, generating solutions, take action, evaluate outcomes. For the bowtie question, remember, to answer a bowtie item, first select the potential condition from the middle well. To make the correct selection, identify relevant data and organize those data to determine what the client's condition is in the clinical scenario. Then review the choices under potential conditions and select the best match for your analysis. After selecting the client condition into the middle section of the bowtie, decide on the nursing actions that would be appropriate to manage the client condition and the parameters that a nurse would need to monitor to determine if those actions were effective. Therefore, read the information in the scenario and recognize which findings are relevant. Make connections to determine what these relevant findings mean and what condition the client may be experiencing, and identify the client's immediate problems. Then identify possible solutions to address the client's needs, the appropriate actions to take, and parameters to monitor once actions have been taken. Bowtie question. Complete the diagram by dragging, or selecting, from the choices below one potential condition, 2 actions the nurse would immediately take to address the condition, and 2 parameters the nurse would monitor to assess the client's progress. Possible conditions include dehydration, hypoglycemia, severe anemia, shock. Possible actions to take include potassium supplementation, glucagon, blood transfusion, oxygen 2 liters via nasal cannula, intravenous fluid. Possible parameters to monitor include urine output, point-of-care blood glucose, electrolytes, pulse oximeter, hemoglobin/hematocrit. Bowtie answer and rationale. The client is most likely experiencing dehydration. There is no evidence of severe anemia, hypoglycemia, or shock at this time. The client needs potassium supplementation and intravenous fluids to correct the fluid and electrolyte imbalance. The client does not need a blood transfusion at this time, oxygen levels are stable, and no oxygen is needed. Urine output will need to be monitored to assess improved fluid balance. Blood glucose does not need to be checked as the client has no signs of hypoglycemia. Pulse oximetry is not needed as this is stable. The client needs routine electrolyte monitoring, but there is no need to monitor hemoglobin and hematocrit as this is stable. Case summary. A 16-year-old female with an eating disorder is seen in the emergency department for fainting episodes. The client is found to be severely underweight, dehydrated, and bradycardic and is admitted overnight to treat the dehydration. Thank you for clicking. I will be posting more videos, so if you like to see more, please click to subscribe, like, and share.